So here is an explanation for the abdominal wall anatomy. So the abdominal wall is composed of muscle, bone, and fascia, and it connects the rib cage superiorly with the pelvis inferiorly. And it functions as a protective barrier enclosing the gastrointestinal tract and the urogenital organs. So it helps protecting these organs, and it also has a function in mobility. So it helps the body being more mobile by allowing the lower back to do flexion, extension, and rotation movements. So first, we will talk about the anterolateral anatomy, and then we will talk about the posterior anatomy of the abdominal wall. So this is a cross-section of the anterolateral abdominal wall. Regarding the anterolateral anatomy from superficial to deep, starting with the skin, this is the most superficial layer. So let's draw the skin in the white color. So this is here the skin of the abdominal wall. And then after the skin, we have the subcutaneous tissue, which will we draw in red. So it comes after the skin, the subcutaneous tissue, like that. And then after the subcutaneous tissue comes the fascia, which is on two layers. We have the fatty superficial fascia, which is called the cumbrous fascia, and we also have the deep fibrous fascia, which is the scarbous fascia. And we will draw the fascia in the yellow color. So this is here the fascia. And after the fascia, we have the muscles, which are the external oblique, the internal oblique, the rectus abdominis, and the transversus abdominis muscle. So the most superficial muscle of those four is the external oblique, and this is it right here. This is the external oblique. And after the external oblique, we have the internal oblique, which is the one in the middle. And then the third one is the rectus abdominis, which is only available in the anterior of the abdomen. So this is the rectus abdominis on both sides. And the transversus abdominis is the deepest muscle of them, which is right here. Now after the muscles, we have the transversalis fascia, which is right here in the white color. This is the transversalis fascia. And deep to the fascia, we have the fat, which I will draw in the blue color. So the fat comes here. And the deepest layer is the parietal peritoneum, which comes as the last layer. So here is another view of the abdominal wall, and we can see the rectus abdominis muscle here, and the external oblique here. And if we dig deeper inside the external oblique, we will find the internal oblique. And deeper to the internal oblique, we will find the transversus abdominis muscle. And the anterolateral muscles extend from the ribs to the pelvis, and they are supplied by the thoraco-abdominal nerves T7 to T12, and the subcostal nerve, which is T12, and the ilio-hypogastric, the lateral cutaneous, and the ilio-inguinal nerves. Now let's talk about the anatomy of the posterior abdominal wall. So we also have the skin as the superficial layer, and deeper to it we will find the subcutaneous tissue. And at the center we have the spine, and lateral to the spine we will find muscles. The muscles include the quadratus lumborum. This is the most superficial muscle of them. It originates from the iliac crest right here, and it inserts into the transverse processes of the L1 to L4 vertebrae and to the inferior border of the 12th rib. So this is the muscle, the quadratus lumborum. This is it right here. And it is supplied by the anterior rami of the T12 to L4 nerves, and it works as an extensor and lateral flexor of the spinal column. The second muscle is the psoas major. This is deeper to the quadratus lumborum. It originates from the transverse processes of the T12 to L5 and attaches to the lesser trochanter of the femur. So it attaches to the femur right here, and it is supplied by the anterior rami of the L1 to L3 nerves, and it works as a thigh flexor and a lateral flexor of the spinal column. So it works on the femur bone to flex it, and it also laterally flex the spinal column. The third muscle is the psoas minor muscle. This is deeper to the psoas major, and it is present in 60% of the population. It originates from the vertebral bodies, the T12 to L1, and it attaches to the superior ramus of the pubic bone, and is supplied by the anterior rami of the L1 nerve, and it works as a flexor for the vertebral column. The fourth muscle is the iliacus. Iliacus is right here on this side, and on the other side is here. It is originating from the iliac fossa and the anterior inferior iliac spine, and inserts to the lesser trochanter of the femur right here. So it inserts into the lesser trochanter of the femur, and is supplied by the femoral nerve, which is L2 to L4, and it works as a flexor and lateral rotator of the femur bone. The fifth muscle is the posterior aspect of the diaphragm, which is present on the superior part of the posterior abdominal wall. We also have a fascia posteriorly. The fascia include the thoracolumbar fascia, which is the most superficial fascia, and it is more superficial than the quadratus lumborum. And we have the psoas fascia, which is the deepest fascia. It covers the psoas, and it is deeper than the psoas muscles. So the two fascias, the thoracolumbar fascia and the psoas fascia, enclose all the posterior wall muscles. So that's it. If you want to learn more about the abdominal wall, I have this playlist for you that you can watch, and I also have a video about the hernia that you can also watch.